Okay, so today we have the pleasure of speaking with Kristen Parise, a passionate pelvic health physiotherapist and educator on a mission to empower her patients and students with a deeper understanding of their bodies. Kristen specializes in pelvic floor rehabilitation, helping individuals overcome challenges, including incontinence, chronic constipation, pelvic pain, and providing essential care for pre and postnatal women. So today's discussion will focus on pelvic girdle pain, which is characterized by pain in the pelvic region, particularly around the joints that connect the sacrum and ilium bones and the symphysis pubis. If you are struggling with pain that is radiating to the lower back, hips, thighs, and legs, stay tuned. So welcome, Kristen. Thanks for being here today. We're so excited to have you.
Marty, thank you. It's my pleasure to be here. It's a topic near and dear to my heart, so I'm happy to chat about it.
Yes. And so maybe we can just start off by talking about what causes pelvic pain during pregnancy and why some women are more affected than others.
Yeah, absolutely. So, I am a pelvic physio, and so one of the things that I think maybe is worthwhile to do is just talk a little bit about the pelvic floor for those that are listening and maybe don't have a very good understanding of it, and then I'll address your question. Does that sound okay?
I love that. Yes.
So, we spend a lot of time thinking about the pelvic floor as a pelvic floor physiotherapist, and especially in the pregnancy period and definitely in the postpartum period. But that pelvic floor muscle is a muscle that runs from your pubic bone back to your tailbone and out to your two sit bones as you sit there, and really does a lot of really important things on a day-to-day basis, including helping us keep us from not peeing ourselves, not pooping ourselves, not leaking gas. It helps support our pelvis, support our core, and support our pelvic organs. And it helps us with pleasure during orgasm, and it helps us to stay out of pain with intercourse. And so then you factor in someone who is expecting, and already we're increasing the volume and pressure that's on the pelvic floor, that's on the pelvic joints. We are increasing our red blood cell volume, so then that changes. Lots of people put on extra weight in the whole trunk area, right? You think about when you're expecting and your breasts start to grow. All of that sits on the pelvic floor. So we want to make sure that then when people end up with pain, and we know it's high, we know about 50% of women will experience some pelvic girdle pain of varying degrees through a pregnancy. And the interesting part is most people think, okay, it's pregnancy related pain. It'll be done once I deliver. And in about 25% of people, that may continue upwards of 1 year afterwards. So, if you're experiencing pain and it is in the maybe the sacroiliac joints at the back, that those are those like bony prominences at the back or at the pubic symphysis, so that bone right at the front, or it's coming into the groin, that's likely pelvic girdle pain. And, you know, there are so many different causes. I mentioned one, when we can have that increase in weight during the pregnancy period. We also know our hormones are fluctuating, and as we start producing that relaxin that is helping to loosen the ligaments, loosen the muscles to allow for that labor, that can impact things. We know that people come to pregnancy with their own issues potentially already. Like you might have had pelvic pain already. You might have had low back pain. You might have been in a big car accident of which you had pelvic fractures. Those people are at more risk for having pelvic girdle pain. We also know that there are things like leg length discrepancies that change the way that our pelvis is. You think about, one leg longer than the other, maybe the pelvis is a little off kilter. The pelvic floor muscle is managing pressures in a different way. Those people are at more risk for pelvic girdle pain too. And then there are other things like genetic changes. So somebody that has hypermobility, just as a blanket statement, or maybe a specific condition like Ehlers-Danlos, where their tissues stretch more just anyway, they're at more risk for things like pelvic girdle pain. So I hope I answered that question.
Yeah. What about a tilted pelvis? Is that also tend to
And so
be something that
pelvis, I mean, I did mention, if you have a leg length discrepancy, you might actually have a tilted pelvis. If you have things like scoliosis, the pelvis might be a bit tilted. Sometimes that is something that is said, like it isn't technically a medical term, but we do definitely see that there are asymmetries even in people that don't have specific diagnosis or issues just because of the way that we use our body. I mean, if you think of yourself, Marnie, when you sit, do you cross your legs?
I am right now, actually.
So when we do that, we tilt our pelvis. So if you're constantly crossing one way, you're putting more pressure on the right or left, and your body um, adapts to that change. If you're somebody who has a job where you're standing all the time, you're putting more weight maybe on one leg, your body adapts to that. So tilted or just asymmetrical, we might actually say as physiotherapists, might impact the way things go during your pregnancy.
Mhm. And what about sciatica? Are you finding a lot of people who struggle with pelvic girdle pain will also have that, will affect their sciatic nerve and cause that pain to radiate down their legs?
Yeah, so we actually try to distinguish pelvic girdle pain from sciatica.
Hmm.
So for those of you that are listening, sciatic pain, in its truest form, ends up being pain that runs down, usually through your bum, down the back of your leg, all the way to the foot, right? Following the distribution of that sciatic nerve. And that is quite different and so some people will have pain, numbness, tingling, but that's quite different from pelvic girdle pain. However, as I mentioned before, if you've had pain in the pelvis or pain in the low back, even outside of pregnancy, and that might be that sciatic type pain, you're more at risk of pelvic girdle pain. It's almost like your system, when it has been in pain in that area, now in pregnancy kind of jumps and goes, oh, okay, well, I'm going to be in pelvic girdle pain too. So unfortunately, people might have both, but we try and distinguish the two because often some of the things we do from a treatment standpoint are different for pelvic girdle versus sciatic pain.
And what would be the best approach for someone who's struggling with this type of pain? Like, would it
Well, first, I
obviously?
would say making sure that you advocate for yourself because, we do hear lots of times by the time that people get to our door, they'll say, I told my birth provider or I told someone, and let me just step back and say a lot of people have fantastic providers, but other people might meet some resistance, say, "Oh, you're pregnant." That happens, right? And so what happens lots of times is when people are in pain, we reduce our activity, and that has so many negative implications. And so first it is recognizing that that pelvic girdle pain is something potentially new to you. It is something that should not be there. So it is common, but it really isn't normal. It is something that we diagnose and treat, and that you can get treatment that is effective and that helps you even during your pregnancy. So don't wait, suffer through pregnancy and say, I'm going to deal with this after I have the baby. There are lots of things we can do if it's identified. And the earlier it's identified, the more successful we might be at some of those things, same as many other conditions.
Mhm. So, are there types of exercises or at-home strategies that are,
Yeah.
yeah, able to?
Yeah, there's lots. So, I mean, as I mentioned, lots of people are exercising and that message seems to be getting out that exercising through pregnancy is such a beneficial thing for you, for the baby, for your mental health, all that kind of thing. The one thing about pelvic girdle pain that most of the research is showing is that being an exerciser doesn't reduce your chance of getting pelvic girdle pain, which it'd be nice if that were actually the case. However, once that pelvic girdle pain is recognized, making sure you're exercising and doing some really good exercise can actually reduce your pain. So the things that we want to get people doing are we might have them doing yoga. We might have them doing exercises like pelvic tilts. We might do some exercise that helps to create a bit more symmetry in the pelvis, as I mentioned before. If we have a really strong right side that's really overpowering the left and it's creating this discrepancy in how the joint is working, we might work on reducing tension on the right side and increasing the left side so they're working, more symmetrically. We can do some stabilization exercises, and that might be doing some strengthening of the muscles around the pelvis. So if you, let's say you were coming into pregnancy and quite weak, maybe you had gone through some infertility and you were, just not doing the things that you would normally do from an exercise basis. That weakness going into pregnancy actually may increase your risk of pelvic girdle pain. So we might do some specific strengthening exercises. We might do some specific and targeted pelvic floor exercises. And as I mentioned, that might be some relaxation, like letting them go, but it also might be doing some really targeted strengthening. And that strengthening might be some motor coordination stuff. It might be some endurance type exercises. So targeted exercises. And, not everybody, unfortunately, can access a pelvic health physiotherapist, or in the States, a pelvic floor physical therapist. But it really is a great thing to be able to do because we can tell you, okay, we think part of the pelvic girdle pain is because X muscle on the right side of your pelvic floor is not working well and your left piriformis is really stuck. And then we can actually address your specific issues. So targeted exercises are great. Um, and then a few of the other things, like just generalized functional muscle training is good. And knowing that if you can keep moving, keep active within your pain limitations, then most people do better. And so that might be starting out by doing some walking. It might be doing even exercises where you're trying to figure out how to shift onto one foot, because a lot of people will come to the clinic and they'll say, I can't go up the stairs. I can't stand on one leg to put my pants on. I can't roll in the bed without pelvic pain. I can't get in or out of the car. So a lot of those are where you're putting a lot of pressure on one leg and doing something else with the other. And so we might do some targeted functional muscle training in order to make sure that your muscles are working as you go into those type movements. And we might do some adaptations too. So I had a woman in the clinic yesterday, and this is what was her issue. And I was telling her, to get out of the car, you don't have to lift just one leg out and followed by the other. You can lift both of them together. Some of my clients use like a house coat belt or just a belt around their legs, and they'll use their arm to kind of help their two legs move out so that we're not creating that separation in the pelvis. This might not be something you're going to have to do for a long time, but when the pain is really bad, any strategy that reduces your pain is helpful. And
Mhm.
same goes for in the bed. We often, if I'm lying on my left side and I want to roll over, I roll over onto my back to the right side. And again, that separates one leg and then the other follows. And that can be really hard in the pelvis. And so things like rolling under. So I'm going to lie on my left side, roll to my stomach, keep my knees together, and then roll to the other side. So there's simple tips and tricks that might reduce pain. And then there's a ton of things, I haven't even mentioned all of them, that you could do to exercise, do stability training, functional movement, yoga, relaxation. All of those things can help with pelvic girdle pain as well.
Are there any specific stretches that would be beneficial for people to do at home?
Yeah, I mean, specific will be specific for the person, I would say, but more generally, I mean, we might be doing things where we are helping to relax the pelvic floor. We often do see, I mean, outside of even pelvic girdle pain, almost everybody that comes to see me says, I have a weak pelvic floor.
Mhm.
And then we go in and assess and find out, oh, not so weak. Potentially that there's some tension and tension holding. Now, as we get over that tension, we might expose some weakness, but lots of times we're doing pelvic floor relaxation exercises, and that might look like a child's pose. It might look like a cat cow with wonderful deep belly breath. It might be deep belly breathing. I have a lot of women with pelvic girdle pain that are just working their way to the end of their pregnancy, and maybe part of their job is sitting down, and they're finding just like hard chairs feel really uncomfortable. And I
Mm,
might get them on a stability or an exercise ball because it allows a little bit of movement. It kind of supports you where you're at. It doesn't, and so exercises could be those yoga type exercises. They could be changing how you're sitting through the day, making sure that you are not sitting or standing in a prolonged position for too long, because that can be
mhm.
hard on the pelvis as well.
Sitting, sitting is terrible.
We
Gotta
should
get.
all have a standing desk with a walking pad. That's my next purchase,
Mm.
actually, Marty.
Hmm. What about support garments? What are your thoughts on external support?
Yeah, and I
Um,
think support garments can be really, really effective. Actually, in at Blueberry Therapy, a number of years ago, I had a few clients who were really suffering, both with pelvic girdle pain and sometimes with vulvar varicosities, so like
mhm,
swelling of the blood vessels and veins in the vulvar area.
mhm,
And they came to me and said, Kristen, I found this amazing product out of Australia. They are called the SRC Health pregnancy tights, pregnancy shorts. And over the years, I've had quite a few people use them very successfully, so much so that now we carry them at the clinic. And I mean, what Sinead, the owner of the company, has done is created this really nice garment that has compression. So it's
mhm.
not quite like 20, I think it's um, how do they measure compression? Anyway, it's not as much compression as maybe compression socks, but it
Right.
isn't a nice compression that helps just hug the baby to you and support the baby, support the abdominals, and yet they breathe really well.
Mm,
So my clients have loved them. I have a lot of clients that are using the pregnancy shorts, and they might wear them under their scrubs, under their dresses, that kind of stuff. And funny story,
great.
so when I started putting them on the website, I did a little photo shoot in them, and like they're tight enough. So even outside of pregnancy, I put on the recovery ones, which are lovely too. And I thought, oh, this is lovely. If I have to wear a real tight dress over the summer, I'm putting
Right.
these on. But they feel supportive. They feel like they're hugging the baby. And even I had a pelvic health physio who was pregnant with twins, and
Mhm.
and she absolutely loved them. She said, you know what? She found as she was getting into the end of her second and third trimester, she couldn't do the groceries, she couldn't stand for too long. Putting the tights on allowed her to do those kind of things. And then she could be more active, right? And so we want people to be active because we know that's good for pelvic girdle pain. So yeah, I quite like, there are many different versions. I happen to like the SRC health ones.
And can you wear them all day? Like, is there a limit to how much time you can wear them
You
for?
can wear them
Or-
all day. I mean, you can wear them as you choose, but the clients of mine that like them often end up buying two pairs because they'll say, while they're in the wash, I need something else, right? And
Mhm.
so they are wearing them a lot. And because they breathe so well, you can wear them up to 24 hours. And I think SRC has done some nice research that showed that the people that wore them, 82% of them found that they were in less pain, they felt supported. And so I think it can be a really good add-on for lots of people, especially when they're already coming to you in pain, right?
Mhm. They sound great.
Mhm.
So, are there any activities or movements that pregnant women should avoid to prevent worsening pelvic pain?
Yeah, I mean, as I mentioned, lots of times people notice pelvic girdle pain when they're on one leg. And so we're going to work at that, of course, because there are times in life you got to go upstairs, you got to go up curbs lots of times. But at the beginning, when they're in pain, we often encourage people to sit down, to put pants, underwear, socks, that kind of stuff. That can be a nice adaptation.
Mhm.
Um, in terms of exercise and activities, certainly if you've been really active, we want to get you back to that. But in pregnancy in general, we're not advocating for very much high impact activities. There are numerous ones out there that we say, maybe lay off during pregnancy. And again, I am a big advocate for exercise in general and listening to how your body is feeling. But there are some where we want people to kind of just slow down a little bit. Um, and then I mentioned prolonged positions and anything that is like uneven weight distribution. So if you notice that you're sitting and you're crossing your legs, or you're standing a lot and you're putting all your weight on one leg, I mean, those are activities that are kind of behavioral activities that are sometimes harder to notice, but easy to change, right?
Mhm.
Potentially.
It's so amazing how we've gone from, back in the day, it was when you were pregnant, don't do anything, don't move, like let us get that for you. And now it's like be active, get your body moving. I mean, that's sort of the same with everything now, right? Because exercise used to be just for weight loss. And
Yes.
now we realize we need it for everything. It's so, so important. So, yeah, staying active, definitely key. So how can a pelvic health physio support postpartum recovery, especially if pelvic pain persists after pregnancy? Because you were
Yeah.
saying it
So
could last quite a while postpartum.
yeah, as I mentioned, I mean, up to 25% of people may experience pain for upwards of a year in the postpartum period if they've had pelvic girdle pain during pregnancy. So, I mean, hopefully you've hooked up with a pelvic physio during your pregnancy and have already developed that relationship and started to work on some things because we know it can be effective at reducing pain. Um, in pregnancy itself, we see, pelvic girdle pain usually starts to come on board around the 18th week, and it often peaks somewhere between the 24th and 36th week. So,
Mhm.
during that time span is a great time to be with a pelvic physio. If you haven't seen a pelvic physio in pregnancy, no problem. See one in the postpartum period. And the things that we do, we will take a real thorough history. We'll find out, you know, what has happened through your pregnancy, but also what happened before that. Had you had pain before that? As I mentioned, had you had car accidents? Had you had any injuries? Maybe you had endometriosis with pain with every period since the time you were 13. Those people are at more risk for pelvic girdle pain too, right? That pelvic pain
Mhm.
begets sometimes more pelvic pain or more susceptible to have pelvic pain.
Mhm.
And then we are doing, we're usually watching you move. We're looking at your posture. That's another thing I didn't mention. But I mean, during pregnancy, we want to make sure that we're using a posture that's not putting additional load through the pelvis. So we're not getting into that big arch of our back because that can really load the pelvis in a funny way, or we're not tucking our pelvis to bring the baby in. Okay.
Mhm.
So we'll look at that in the postpartum period. We'll look at core strength, abdominal strength. And then with consent, a pelvic physio will do that internal assessment. And that assessment really is trying to understand better how that internal muscle, the pelvic floor, is working, and whether it is in the postpartum period, whether there is too much tension, whether there's not enough tension, whether there's asymmetrical tension, and then we might be doing all the other things a pelvic physio would do too, like how are you peeing? How is pooping going? Have you returned to intercourse? And is there any pain, or you just don't feel anything with intercourse? So those are the things that we would be doing in an assessment. From a treatment standpoint, if you're still having pelvic girdle pain, we're likely getting into doing either muscle lengthening exercises, again, if that pelvic floor is holding a lot of tension, because the pelvic floor, one of its roles is to hold the pelvic outlet together.
Mhm.
Delivery itself, the pelvic outlet opens and it needs to open to deliver that baby. But lots of times that muscle then is more taxed in the postpartum period, right? Because we have a bit of laxity because of hormones, potentially because of breastfeeding. Um, and the muscle is having to like work super hard to maintain that pelvic outlet. And so we're doing lengthening exercises like cat cow, like child's pose, like deep breathing. We might be starting and then to get into some pelvic floor strengthening and using that in a functional way. Like, how are you activating your pelvic floor as you pick this baby up off the floor, off out of the crib? Um, what are you doing in terms of baby wearing and how is that impacting things? So I think integrating core strength and pelvic floor strength into what your postpartum looks like is really important because, especially first baby, there's a lot of change in your life. And, getting back to exercise or doing targeted programs when, the majority of your focus is on this new little one, is just too tough. And so, how do we integrate that? And then, what are some of the measures that we might do to reduce pain right away if you're in pain? And that might be as simple as, you're breastfeeding a lot when the baby is really little or feeding a lot. Can you do it outside of a seated position? Are you side lying? Can you stand? If you have a partner that can use a bottle, can they help you with that? And so some of the recommendations aren't um they're not rocket science, but in that time when it's brand new to you, you're sleep deprived, you're in pain, you just need some simple answers sometimes.
Mhm. Are you finding, women who have C-sections versus a vaginal birth, are you finding the pelvic girdle pain lasts longer for some more than others, depending on the group they fall in for delivery?
Do you know what? I mean, to be honest, I haven't looked up the research specifically on that, but
Mhm.
anecdotally in my clinic, it doesn't make a big difference, actually. I find, if somebody has pelvic girdle pain in the pregnancy period, they may or may not have a C-section, and they may or may not end up with ongoing pelvic girdle pain, in the postpartum recovery. That would be worthwhile for me to look up, actually.
Yeah.
But but if somebody does not have a vaginal birth and has instead a C-section, there are other things that might contribute to some discomfort, right? You're healing from an incision. You are, that incision is through layers and layers. It's through skin and fat and muscle and uterus. And, so I always say to my clients who've had a C-section, and sometimes they're surprised at how much pain that they are in. And I when they learn about, all the structures that are cut through to bring out this beautiful baby, it kind of makes sense, right? And I would say that actually makes me think about the pain and neurobiology of pain research. So
Mhm.
one of the other things, both in pregnancy and the postpartum period, if people have been in pain longer than 12 weeks, not only has their body changed, but their brain has undergone a change. And so we are often getting into that too. So, meaning we actually, and so people are like, oh, Kristen, are you saying it's all in my head? And I'll say, absolutely not. What I'm saying is the structure and the chemistry of your brain has changed because you've been in pain longer than 12 weeks. And so, what can we do to reverse that? That neuroplasticity is a double-edged sword, right? Like we can get into pain and the chemistry changes, but it also means we can get out of it. And so, what are the things that we're doing to reduce stress? I mean, that's the other thing that we see is that people who are in a situation going into pregnancy, maybe they're in a job that they absolutely hate and stressful, or they're in a partnership, or they're not in a partnership and that's really stressful. Those people are at more risk for pelvic girdle pain.
Mhm.
So we want to talk about stress. We want to talk about how do we down regulate the nervous system by the simplest is doing some really nice deep breathing for a few minutes. But it might be opportunities to listen to a meditation while you feed your baby. It might be positive activity, so getting out for that walk, even if it's a few minutes in nature where so there are lots of things, and so that's not isolated certainly to those who've had a C-section. But we could be talking about pain and mechanisms related to pain in both pregnancy and postpartum.
Mhm. It's interesting. I remember I had a C-section, and after when I was postpartum, I had terrible back pain, and I didn't know where it came from. But then I realized, oh, my core was ripped through,
Yeah.
and I was usually using my core muscles, and now I was having to use these back muscles that I wasn't used to using. And so it was a lot. And I remember there were some times where I couldn't even get up off the floor. Like it was very intense pain. But again, yeah, it's interesting. Everyone's story is different and everyone's recovery is different. And I remember going for physio after, and they said, "Yeah, you got to address the pelvic floor here." So yeah, very
Yeah.
important.
It is really important. So with anyone, I always say, I want you to think about your core like a cardboard box. So your diaphragm, that big breathing muscle at the bottom of the ribs, is the top of the box. Your pelvic floor is the bottom of the box. Your abdominals, the front three sides, and your low back, the back. And so if you've got this cardboard box that's working perfectly, it stays, in good shape, everything works.
Mhm.
That core, you're layering stuff on it. You're layering your lungs and your shoulder girdle and your head and everything. So you need it to work really well.
Mhm.
In people where they have had weakness in one structure or another. So let's take the pelvic floor, for example. I say, take that box, dip it in water, and what happens is the bottom of the box bows out. And as soon as you do that, you lose stability, right? You lose integrity of that box.
Mhm.
On the flip side, if you're in all kinds of pain, take that box and scrunch the pelvic floor up. That tension in the pelvic floor, because of pain, changes how the back works, changes how the diaphragm works, changes how the abdominal cavity. So
Mhm.
a C-section itself, you're taking a chunk in a way, theoretically, out of the front of the box. And then something else has to carry the load. And for lots of people, it is the low back, it is the pelvic floor. We stand and move it a different way when we're in pain. And at the same time, you're having to take care of this little one and you're moving around and you're lifting, even though you're not supposed to be lifting. I mean, that's a total dichotomy, right? When in the postpartum, they say, oh, don't lift anything. And the carrier itself is so heavy.
Me. Oh my gosh, yes. I
Mhm.
remember my friend, she used to have to help me with the stroller, like to get it into the trunk. I couldn't do it for a
Yeah.
while afterwards. Yeah, they don't tell you all these things. And then you're living it. And then
Yeah.
people are, yeah, like even if you're a single mom and you don't have a choice. You have to lift, even though they tell you not to for 6 weeks, you're gonna be lifting. So
Hmm.
it's a bit of a catch-22.
It is. It is. There's a patent out there somewhere for somebody to make, which is a very light car seat. I've thought about this for like 15 years
Genius.
because the things are heavy, and then the
So
baby gets heavier and heavier at a year
absolutely.
with this, like, so, the other thing I would say is, if we can get you out of pain in pregnancy, we can get you doing some good resistance training. And it is well worthwhile because in the postpartum period, you have to be strong. You're getting on and off the floor. You're lifting this car seat. You're lifting a stroller. You're holding on to baby for long periods of time. And so, I mean, some of what we do in the pregnancy period is to prepare you for being a mom, not for your bikini body and all that kind of stuff. We want you to be really functional. We want you to be able to do the things that you'd like to do with your new little one, not in pain, and with the endurance to be able to do it. I mean, it is sometimes moms will say to me, I feel like, I'm not doing any exercise. I haven't got back to the gym. I haven't done this. And then I'll look at what is their step count on their watch? What are they doing on a day-to-day basis? And I'll walk them through all the things that they've done, even in a day, and they're amazed even. So it's a shift in the way we think about exercise and weight training and resistance, but there's a lot of it that is almost necessary in the postpartum period.
Mhm. Breastfeeding also is a workout. So
Yeah,
there you go, right?
yeah.
Yeah.
Yeah, and metabolically, breastfeeding is a huge workout, right? The ability for your body to produce breast milk. I mean, there's so many things in the postpartum period that are stressing your body, not necessarily in a bad way, but in a different way that you haven't been through before.
Mm-hmm. Mm-hmm. Yeah. Well, Kristen, this has been amazing. I think this is going to be a really big help for so many women who are struggling, who don't even realize that they have been struggling with pelvic girdle pain, and knowing that it can also affect them postpartum. So thank you so much. This has been really wonderful.
My pleasure, Marnie. Anytime. This is a topic, as I said, that I love to talk about and to educate. I mean, that is my mission this year in particular, is to really to provide really good education for people, for healthcare professionals that are working in this space. And I think, each little bit that we do helps another person. So I'm very, very happy for the opportunity.
Yes. Well, you're doing a great job. Keep at it. And we'll talk soon.
Okay, thank you.
Okay.